All right, good morning. We are actually going to be discussing the basics of pathophysiology today. This is officially the first unit of the course. Okay. Hold on. All right, here we go. The objectives are to evaluate the mechanisms of pathophysiology, differentiate between signs and symptoms. Those are two different things. We do not use them interchangeably. Okay, and we'll discuss more on that as we go along. Distinguish between structural and functional diseases. Once again, these are two independent things, and we will discuss a little bit further. Homeostasis, the process of maintaining normal balance within the body. This is if you are completely healthy and you don't have any lingering illnesses, diseases. If you have asthma, your asthma is not flaring up. You are in a perfect symbiotic state at this point. You are within homeostasis. Um, Traditionally, our bodies will operate off of normal homeostasis. However, there are times that we can get out of homeostasis. This could be because of illness, disease. It could be because of trauma. If you're involved in a car accident and you suffer injuries, you are going to be out of the homeostasis. Okay, and so there are many things that can take us out of homeostasis. Okay, now once we get, if we do sustain the injury or get sick, let's take the flu for example. One day you're not feeling that good, you wake up, you just feel really blah, and you take your temperature and you're running a fever, and you're like, this is probably just a little cold, I'm going to go on to school. As the day progresses, you get to feeling worse and worse, and you go to the school nurse and she takes your temperature and you're running 102 fever. And she's like, you're running fever, you're going home. You go to the doctor, they do a flu test on you. It comes back positive, either flu A or flu B. And now you spend the next 5 to 7 days wishing for sweet clean death, okay? Because it sucks having the flu, especially if you have a really bad case of the flu, and it can really hit you super, super hard. Well, at that time, your body is out of homeostasis. Okay, you are dealing with a virus that is invading your body. It's taking you out of that homeostasis and putting you into this I wish for death phase. Okay, but miraculous, we have Tamiflu, which decreases the effects of influenza, and it will also help with recovery time. So you get on Tamiflu. Day 4, you wake up, your fever's broke, you're starting to feel a lot better. Well, now your body is trying to get back into that homeostasis. Okay, it's gonna take a little bit, but you will eventually get back to that homeostasis. Um, level. Disease. When homeostasis is not maintained, disease ensues. When your body gets out of homeostasis, you become more susceptible to become sick, to becoming ill. Say, for example, let's say you get a bacterial infection, okay? Say a UTI, okay? Say you get a urinary tract infection. Well, your system's already depleted because you're dealing with this UTI. Say you get another foreign invader that comes in. Well, now because your body is already trying to deal with this UTI, your body becomes more susceptible to you becoming ill with something else. Okay, does that make sense? You're dealing with one thing. If another foreign invader comes in, now you're dealing with that. You're dealing with that because your body's already trying to fight something off. Your immune system is already compromised. It's already running low. It's working overtime to try and deal with this other pathogen. Now you you interject this other one in there, and just your body can't fight it off. Okay, so you can get sick with that as well. Okay, medical professionals who study disease are called pathologists. Okay, now there's different forms of pathologists. Okay, the one we're most familiar with is the forensic pathologist, the ones who, following death or whatever, they study why someone died, what, the coroner, what caused this person to drop over dead at their job. Make sense? Okay, two common specialties are autonomic pathology and clinical pathology. We will discuss those further here in just a second. Pathology, the study of normal function in the body and how the disease process works. Okay. So once again, the study of normal functions in the body, how the disease process works. How does your body function normally as opposed to abnormal? And how does disease process works? Okay. We know disease invades the body. Okay. It comes in, it finds a weak spot. Let's take Ebola, for example. Ebola comes in and I'm setting a timer so I know how long we need to go here. The Ebola comes in, it finds a host cell. It invades that host cell. And we'll talk more about this when we actually get into the unit on Ebola. But when Ebola comes in and finds a host cell, it takes over that host cell. Also, what it does is it disguises itself to look like a normal, healthy cell. So then what happens is it goes in and it starts sending out all its little messengers out into the body that give the appearance of normal microbes, normal host cells. And then they go in and start invading. They start taking all that over. Okay, Ebola is a very violent disease in the disease world. It is, you study it, and it is extremely violent the way it takes over the body. And so, pathophysiology is a study of how does this happen? How does this work? Now, we take a little step further in this class because we also want to add trauma into there, because trauma takes you out of that homeostasis. Okay. Yeah, granted, it's not disease, but it can still impact the body. Okay. Pathogenesis. The development of a disease is referred to as pathogenesis. Genesis meaning origin or development. Okay. How do disease originate in the body? How does the common flu originate? How does this influenza originate in the body? How does TB originate in the body? When we're looking at the origins of a disease or an outbreak, we are studying the pathogenesis of it, okay, the beginning of this outbreak, okay? When COVID hit, when it first started occurring in Wuhan, China, back in 2019 in the winter months, they started trying to figure out, okay, where did this come from? There's differentiating opinions on that. Some say it evolved from the wet lab, or I'm sorry, a wet market in Wuhan, China. And for those of you that do not know what a wet market is, it's a market. It's instead of you going to Tom Thumb or Walmart where everything is dead and you buy it already, cleaned and defeathered or whatever processed. A wet market, you do not. The animals are alive. They kill them there and for you. They will take the feathers off of them for you. They'll depuck them. They'll do all this stuff for you there, okay? But the thing is, these animals are alive. They're at the wet market, okay? And so that's one theory. The other theory is it began in a CDC lab that's located in Wuhan, China, and Chinese virologists were trying to study and work with corona, because corona's been around since the 1960s. This is not a new virus, okay? But that it escaped from the Wuhan CDC lab, okay? That's the other ongoing theory. So we got two working theories on that right now. But pathogenesis refers to the beginning of it in the body, okay? How did this invade the body? the cycle of disease, the cause. What caused it? Once again, let's take flu. We're going to use influenza a lot because it is easy to work with. Everyone understands it, and it's a very interesting disease, okay, or virus. Cause. What causes it? Well, you are exposed to someone that has either influenza A or B, okay? The problem with influenza is that it mutates at such a rapid pace. That's one of the reasons that we have a hard time getting a true vaccine for it. Many of us get flu shots. And how we govern that is we look throughout history and look at different strains of influenza that have exposed themselves in different years, okay? And then we see what kind of cycles we're running. Also, we look at the Southern Hemisphere. We're coming out of summer right now. Well, in the Southern Hemisphere, they're in winter, okay? And flu normally hits in the wintertime. So typically it starts in the Southern Hemisphere first, and then when we get into our late fall, early winter, then we see the rise of influenza in the Northern Hemisphere. So we look at the cycles of influenza, and then we look at how it is in the Southern Hemisphere. If they're having lots of influenza cases in the Southern Hemisphere, chances are we're going to have a very high flu season here in the United States or in the Northern Hemisphere. Right now, oddly, what we're seeing is in the Southern Hemisphere, we're not seeing a lot of influenza cases. Now, that could also mean that due to the fact that we're dealing with COVID, and typically, if you have one main virus, a secondary virus has a hard time really finding itself. That could be the reason that we're not seeing a lot of influenza cases in the Southern Hemisphere at this point. However, that can also change. So we could, here in the next couple of weeks, you can see a huge spike in influenza cases in the Southern Hemisphere, which could be indicative of how it's going to be here in the Northern Hemisphere. We could have a very mild flu season to begin with, but then towards the latter part of it, we could see a huge spike in influenza cases, okay? So the cause of it, how do we get sick from it? I'm in class, someone sneezes, someone, puts their hand over their mouth and coughs into their hand or sneezes into their hand. They go and they touch a surface. Someone comes behind them and touches the surface, or they shake hands or they touch them, excuse me, in some way that passes this along, okay? Incubation time. The time that you are exposed to the disease until the time that you start presenting with signs and symptoms of it. Okay, this is your incubation time. How long until we start seeing signs and symptoms of influenza? Well, it varies. Typically, influenza incubation period is around 7 days, and so typically, now once again, this is typical. Okay, doesn't mean always. Okay, there's always extenuating circumstances to incubation time. Okay, this is what we generally go by, though. The influenza incubation time is around 2 days, 2 to 4 days. Okay, from time of first exposure. That could be up to 7 days. Okay, but typically between 2 to 4 days from the time you first expose is the time you start having the first signs and symptoms. It may start out as body aches. It may start out running a low-grade fever, but typically with influenza, one of the telltale signs of influenza is you spike a fever pretty fast. So you're not going to have that gradual uptick in influenza and as far as temperature. It's going to hit rather fast. You're going to, like I said, typically it starts out body aches. You're going to get hit with it, and then you're going to feel like dog crap for the next 7 days. Okay, that's life. If you get on Tamiflu quick, it can lessen the time that you're actually bedridden. Okay, so typically, say influenza normally has you incapacitated for about 5 to 7 days. Traditionally, you can be sick as long as 14 days, 2 weeks with influenza. But say you get on Tamiflu real quick, they're real early to recognize it. They get you on the first doses of Tamiflu, and within 3 to 4 days, you're feeling much better, and you're not wishing for death anymore because you just feel horrible. Okay. Um, uh, Ebola's a little different. Incubation can be between 2 days to 21 days. Okay, so we have a longer incubation period time with Ebola. Ebola's both are extremely complicated viruses, but Ebola sometimes just takes longer for it to set into the body and start the disease process. COVID, with COVID, we're looking at anywhere from 2 to 14 days. Okay, that's why we're saying if you've been around or exposed to anyone with COVID, you need to quarantine yourself for 14 days. So right now, we've seen the incubation time be anywhere from 2, not as long as 14 days. That's why after day 14, no signs of symptoms are shown. We feel pretty safe that we can start integrating back into society and go back to work, school, etc. And we did not come down with any signs or symptoms of COVID. Manifestation, signs and symptoms. Okay, so we go from cause to incubation period. We have the incubation period. Once again, let's use flu. Day 2 of first being exposed to someone with influenza, I wake up that morning, my body aches. And this is a this is a symptom, okay? It's not a sign. Sign is something I can see. So let's put ourselves as healthcare workers, because eventually that's what we all want to do. So let's set ourselves as a healthcare worker. A patient comes into the hospital, clinic, or as a paramedic, you show up to their house. What you see is a sign. What they tell you they're experiencing are symptoms, okay? So if they're telling me my body aches, that's a symptom. I can't see that their body aches. I'm going by what they tell me. They tell me their body aches, and I have to take them at their word, okay? I can't visually see that, okay? A fever, I can see signs of a fever, okay? I can see red, sometimes their eyes glassy. I can see sometimes their face might be flushed. Sometimes they may have a viral rash, a febrile rash that they break out. You'll see this a lot in infants and toddlers. If their body's fighting off a fever, they'll have all these little splotches all over their chest, their stomach, their neck. And so I can see signs of that. Plus, I can use diagnostic tools. I can stick a thermometer in their mouth or use a temporal thermometer, and I will see the sign of the symptom of fever. Nausea. I can't see nausea. If someone tells me they're feeling sick to their stomach, that's a symptom that, once again, I have to take them at face value on that. Okay, they're telling me, sir, I don't feel well. I feel like I'm about to throw up. Now, once they do throw up, now that becomes a sign. I can now visually see them throwing up. Okay, so once again, signs are things I can see. Symptoms are what patients tell us. Okay? Recovery. So, incubation time to flu, 2 days. I'll wake up, body aches all over. I start running a massive fever, and I just feel like trash. Okay, I go to the doctor. The doctor says, sir, what's going on? I have body aches. I hurt all over. They take my temperature. They see that I'm running a high fever. They're going to give me a flu test. They give me a flu test. The flu test shows that I have influenza, and they'll tell me whether it's type A or type B. They put me on Tamiflu. I go to the pharmacy. I get my prescription. I get other little things, fluid and stuff that I'm going to need during my convalescent period of trying to recover from this. And then I go home and I lay in bed. This is your recovery phase. Your body's going to run through the gamut of the sickness, of the virus, okay? You're going to take your Tamiflu. You're going to try and stay hydrated, drink plenty of fluids. You may not have an appetite for a few days, okay? But you still need to try and eat something. And so then I start feeling better. I wake up on the 4th day, my fever's broke. My body aches, for the most part, have gone away. I'm starting to feel better. I am now on the road to recovery. A couple more days, I feel like I never had the flu at all. I am fully recovered, okay? And so this is the life cycle of a disease. You have the cause, what causes it to invade your body. You have the incubation period from the time you first get exposed to the virus or the pathogen to the time you start showing signs and symptoms. You have the manifestation of the signs and symptoms, and then you have recovery phase. 2 types of diseases. Acute disease, sudden onset, which runs a severe but short course. Okay, anything that that comes on quick is acute. Okay, this is the medical term we use for sudden onset. Okay, if we have acute dyspnea, first of all, dyspnea is difficulty breathing. So if we don't have a history, say, of emphysema, COPD, something that's going to cause us to have breathing difficulties, then it's going to be acute. Okay, I'm sitting here watching TV, and all of a sudden I start having difficulty breathing. That's acute onset. It just started. I have no history of this. I wasn't doing anything to bring this on. Okay, I didn't go out and run a marathon. And if you see me, you clearly understand I don't like running. I don't run. I run if I'm being chased by somebody with a large knife. Then I'll run. But I'm not prone to running marathons. Okay, that's something I honestly say I've never done and probably will never do. So acute heart attack. Okay, most of the time heart attacks can be sudden. Okay, you have the it's called the widowmaker. You won't show any signs or symptoms of a acute myocardial infarction. Okay, that's an AMI, acute myocardial infarction. This is the clinical term for a heart attack, and it's acute because it's an onset. I was outside mowing the lawn. I had an acute heart attack. My heart suddenly stops. It goes into a dysrhythmia, which is a rhythm outside of the normal. It's called normal sinus rhythm. Okay, so it could be V-tach, it could be V-fib, it could be a systole, which is flatline. Okay, so it could be all these, but anything with a sudden onset, we classify as acute. Chronic is anything long-term. Okay, so diabetes. If you are diagnosed with diabetes, okay, this is a chronic disease. Okay, lung cancer is a chronic disease. COPD for people who have emphysema, who smoke 12 packs of cigarettes a day for 30 years, they have a chronic disease. This is something that's recurring. Okay, it's not going away. Okay, so we need to understand and be able to differentiate between sudden onset, acute, and chronic. Okay, because many diseases are chronic. Okay, so it could be anything from you having bladder cancer, something like that is a chronic. So this can lead to other things, and it's due to you having a chronic disease. Okay, let's take jaundice, for example. Jaundice is a yellowing of the skin. You can see it in the sclera, or the whites of the eyes. They'll have a yellowish tint. Excuse me. You could see it in the nail beds. They'll have a yellowish nail bed. Okay, this is because the buildup of bilirubin in the body, and this is due to normally hepatitis or liver cancer, cirrhosis of the liver, something like this. So this is a chronic long-term disease. Okay. Predisposing factors: age. Newborn babies. Okay, newborn babies do not have the immune system built up to withstand various viruses or diseases. Okay, Now, if the baby's being breastfed, then they're getting a lot of these antibodies and stuff from mom, and that's great. Okay. Traditionally, the rule of thumb was if the baby was breastfed, they're healthier. That's not always the case. So, and we know people who breastfed all their children, and their children have chronic sicknesses. They're always coming down with the RSV, respiratory virus. They're always coming down with something. Okay, and you have others that the baby never was able to latch or breastfeed, and so they were fed with formula, and they're healthy as can be. So, age isn't always a factor as far as newborn babies for disease or viruses or sicknesses. But because they are brand new to this world and they have not been exposed to various things, they are just in general, babies are more susceptible to becoming ill. Okay, especially when the thing called hand, foot, mouth disease. Okay, anyone that's had siblings, may have encountered their sibling dealing with hand, foot, mouth disease. Okay, they develop sores in their mouth, on their body, and it's from what I've been told from the physicians and stuff. It's very painful for the children. My daughter had it when she was about 6 months old. Broke my heart, and so, but they do recover from it. Immune system is immature. Okay, once again, they don't have all the antibodies built up in their body yet to withstand certain things. Okay, liver enzymes are often lacking. Okay, one of the reasons we are able to fight off certain things are the enzymes that our body produces. Okay, so their livers have not fully taken over control yet, and so there's a delay in the enzyme creating process. Okay, which can lead to them becoming more susceptible to diseases. Fewer nutritional reserves. Okay, think about them. They've been living off mother for 9 months. Okay, through the umbilical cord. Now they're out in the world. Well, they are even in a mom's diet. They're limited to what they've been getting. Okay, so they do not have the nutritional reserves that, say, a 3-year-old has that eats solid food and has been for 2 years. Okay, so this makes them more susceptible to sickness as well. Less body fat to insulate against cold. Okay, yes, babies are chubby. Okay, however, their bodies are disproportional, or actually their heads are disproportional to what the body is. Okay, while their body does look chubby, it's not insulated well. So that's why we have to maintain their body core temp to make sure that they don't get cold. Once they get cold, they become more susceptible to becoming sick. Okay, elderly, decreased immune function. As you get older, your immune system becomes less active. Okay, so as you get older, your ability to fight off certain things decreases. Okay, that's why we have one reason we see with COVID why it's so deadly to the elder population is the fact that their immune system does not function the way that a 20-year-old's immune system does. Now, here's the interesting thing. If you look at the influenza outbreak of 1918, the Great Influenza of 1919, the majority of people who died in that influenza outbreak were 20 to 40 years old. This is odd. This goes against every virus or disease that we know that targets the young and the elderly. The influenza outbreak of 1918, 1919 did not do this. And come to find out, most deaths that occurred due to the 1919 influenza outbreak did not die because of influenza. They developed what's known as bacterial pneumonia. And so this is what they died from, okay? And we'll talk more about that when we talk about diseases. Decline in homeostatic mechanisms. As you get older, your body does not work the way it once did, okay? This is part of it. Okay? This is just part of getting older. You get out of homeostasis much quicker than you did when you were in, say, 22 years old. Okay, and this allows you to be more susceptible to a greater host of illnesses. We see a lot of the elder population dealing with depression. Many are isolated. Think about it. Either many are living in retirement homes, or many living in skilled nursing facilities. We don't see a large elder population living by themselves and going out doing everything. Okay, so there's a sense of isolation that they face, and this can also deal and lead to depression. When you're depressed, it can go one of two ways. If you're depressed, you can either bury your face in a pint or a gallon of Bluebell ice cream and eat it in that way, and eat your depression and eat your feelings, or you don't eat. Okay? Typically, people who are depressed do not go, you know what? I'm going to eat 3 meals a day. I'm going to have a nice steak dinner. Okay? You're either overeating or you're undereating. If you're undereating, that's going to lead to something known as malnutrition. All right? So when we talk about malnourishment, you're not eating enough or just not eating at all, and this does not provide your body with the proper enzymes, proteins, everything it needs to function on a daily basis and to keep you in that homeostasis. Okay, now we can deal with malnutrition as children, we can deal with it as adults, and we can deal with it as a geriatric, which is an elderly person. And so there are different stages of this. If you look at someone that is dealing with eating disorders, then these people dealing with eating disorders, they're eating, many times they're making themselves throw up afterwards. So their body's not getting a breakdown of the proteins, of the fats, of the oils that your body needs in order to work and process on a daily basis. This can lead to malnutrition. If we look at the elderly, many times they won't eat, or their diet is extremely poor because of either the inability for them to actually get in the kitchen and make something for themselves, not having a family member around to help them in the kitchen. So this can lead to many different malnutrition diseases and viruses that come from just not being properly, not dealing with proper nutrition. Excuse me. Predisposing factors. Sex. Men are more likely to develop gout. Women are more likely to develop osteoporosis, which is the thinning of the bones and the bones becoming more brittle. Women are more than likely to develop breast cancer. Now listen to me. Men can also develop breast cancer. The reason behind this is because men also have breast tissue. Okay, every man out there has breast tissue, and so anywhere you have tissue, you can develop cancer. So men can develop cancer. However, women more likely will not develop testicular cancer because just how the system is made up. Men have the testes, women have ovaries. So therefore, it's a different process. So women are more likely not going to develop testicular cancer, but men can develop breast cancer. Okay, but on the flip side, men will not develop ovarian cancer. Okay, and these are predisposing factors due to gender, sex. Okay, I'm going to go and stop there for right now, and I'm going to open up for questions. Okay, we will now go live and for anyone that has questions, anyone that needs further explanation on anything.